Hello, thank you for joining the ERJ Podcast. My name is Dr. Don Sin. I'm the Deputy Chief Editor of the European Respiratory Journal. Today, I'm joined by Professor Nick Hopkinson to discuss his latest paper, Oral Nitrate Supplementation Improves Cardiovascular Risk Markers in COPD, a randomized controlled trial. This paper is published in the February issue of the ERJ. Dr. Hopkinson is currently a professor of respiratory medicine at the Imperial College in London. He is also an honorary consultant chest physician at the Royal Brompton Hospital, where he also leads the advanced COPD program. He is an international leader in the prevention and treatment of patients with COPD. Good morning, Nick. Many thanks for joining us today.
Oh, thanks for having me on.
Can you give our audience a short summary of your paper and its relevance for patients living with COPD?
The paper describes a pretty straightforward study. We conducted a randomized controlled trial in people with COPD who had a systolic blood pressure of at least 130 millimeters of mercury. And they were randomized to once daily consumption of a 70 ml shot of beetroot juice or to a matched placebo drink that had had the nitrate removed. And they took that once a day for 3 months. And we essentially looked at the effect on blood pressure, on exercise capacity, and on measures of endothelial function. And essentially showed that the active treatment, the beetroot juice, which is high in nitrate, was associated with a reduction in blood pressure. And we hope that will translate into a reduction in cardiovascular risk, also an improvement in exercise capacity and an improvement in endothelial function as well.
Very good. Why is endothelial function, or for that matter, blood pressure, important for patients living with COPD?
Well, cardiovascular disease is very common in people with COPD. COPD is a disease associated with older populations. It's associated with smoking, which of course increases vascular risk. And there are more complex interactions whereby the inflammatory processes and other physiological stresses associated with COPD increase the risk of vascular disease directly. So people with COPD, of course, can succumb to that disease and they can develop acute exacerbations and develop respiratory failure. But for a lot of people with COPD, they have heart attacks and strokes, which we want to prevent. There is also an association between acute exacerbations. So when people have an acute exacerbation, the risk of having an acute cardiac event in the period after that is quite significantly increased. So if we want to help people with COPD holistically, if you like, it's important to think about them as people who are likely to have multimorbidity. Multimorbidity is the norm in COPD, not the exception.
In fact, I think about a third or more of our COPD patients ultimately die from cardiovascular events. So cardiovascular disease is a very, very important problem in our community. Can you explain some of the science behind the beetroot juice? What's in the beetroot juice that protects the endothelium against bad actors and lowers blood pressure?
So the active component is nitrate. And there are sort of two pathways by which this is produced. There's a nitric oxide synthase, and the function of that in the endothelium is impaired in people with COPD because it's impaired by inflammatory processes, and by oxidative stress. But there's also a separate pathway where nitrate is reduced to nitrite, which is then reduced to nitric oxide, particularly in conditions of hypoxia and acidosis. So there's another pathway. And dietary nitrate supplementation increases the amount of nitrite that's available. And, there's evidence that this can, as well as improving endothelial function, also improve the efficiency of muscle. So it actually seems to reduce the oxygen cost of muscle contraction. So nitrate supplementation, and particularly beetroot juice, is being used by athletes to try and improve athletic performance, and is available in health food stores to buy these sort of beetroot shots. And essentially the question was whether this thing that improves exercise capacity, which is limited in COPD, and will also improve vascular function, or could do, whether this will be something that also was helpful in COPD.
Nick, the other day, a patient of mine came in and said he doesn't really like beetroot juice, and he wanted to take a pill, and he found some at a over-the-counter source. Is there a material difference of the nitrate in a pill form versus a dietary source? And so should I inform him to take the dietary source, or they're all equivalent?
I mean, nitrate's not a complicated chemical. So it's likely that, certainly the nitrate effect will arise however it's consumed. The nitrate is a component of a healthy diet that is high in green vegetables. So to some extent, we're dealing with what Andy Webb in the editorial he's written that goes along with this paper describes as nitrate deficiency. So the beetroot juice is a good way of, improving people's diet so that they are getting enough of this. But there are obviously other ways, and people that already have a diet that's very high in green vegetables, or may well not get an enormous improvement. The attractive thing about the beetroot juice is that it is a normal foodstuff that you can consume that will achieve, a health benefit, we hope. And obviously some people don't like the taste, and a few people find that they have sort of stomach upsets and so on. But we've had in this trial and in previous work, we've done very high rates of compliance with this. So I think most people can get used to it. And who knows, it may even be that the fact that it tastes a little bit bad makes it more effective as a medicine. Because
for sure, I think if patients can take it in from their diet, that's much better than a pill. You mentioned other vegetables that are enriched with nitrates. What are some of those in addition to beetroot?
I think the green leafy vegetables in particular are good. But, it's likely that the nitrate component is one of the things that makes a healthy diet healthy.
I see. So maybe Popeye was right. Spinach might also be very good.
I think spinach is probably a good one.
My Asian ancestry tells me that bok choy will be also very good, and lettuce. So I think there are plenty of choices that patients have.
Yeah. So one of the questions is why beetroot juice? And I suppose it is partly just a question of convenience, that it's available as a healthy product out there for sale already. The other half of that is that it's very convenient to use for clinical trials, because the company that produces the beetroot juice shots that we used also produces a matched placebo where they just run the beetroot juice through an ion exchange column and take the nitrate out. Nothing's ever easy, but it's a fairly straightforward thing to do clinical trials with, because you can test the effect of the nitrate with absolutely identical drink right down to the fact that it causes some discoloration in people's urine because of the sort of pigments in the beetroot juice.
What's the dose? Is it 1 glass a day, 2 glasses a day, 10 glasses a day? What would you recommend as a quote unquote therapeutic dose?
The shots that we used have 70 ml shots, and they've got 400 milligrams of nitrate in them.
Okay. So I think for most folks, they can just take 1 glass of beetroot juice a day, more or less. You mentioned something about COPD exacerbations. You didn't test that in your study, but would you expect a glass or 2 of beetroot juice a day to reduce the risk of exacerbation? And then going one step further, do you think that beetroot juice consumption can reduce the risk of cardiovascular events in patients living with COPD?
I'm not sure that it would reduce the risk of having acute exacerbations, but if the findings of this study were borne out in larger, longer-term studies, I think it's certainly very plausible that this would reduce the risk of cardiac events triggered by acute exacerbations. What we really need to do is to test this out in a much larger population for a longer period of time. But it's easy to recommend that everyone should start doing this, but we've done this trial in about 80 people. We've done a previous trial where we've looked at the effect of beetroot juice supplementation in the context of pulmonary rehabilitation with similar results. So there are a couple of trials now sort of confirming this, but in the UK alone, we have 1.3 million people with COPD, with a diagnosis of COPD. So we obviously want to have good, strong evidence before making a recommendation that, the hundreds of thousands, millions of people worldwide start consuming this stuff. You need to be really confident that it's going to be work and there aren't going to be any catches or nasty surprises.
Having said that, do you see any downside to beetroot juice consumption for patients with COPD? Are there side effects that, other than discoloration of urine and stool, are there any significant side effects that you've noticed, or any unanticipated events that you saw in any of your trials?
Not so far. So some people just say, I can't drink this. I don't like the taste. But again, that's not been that common. A few people had stomach upsets from it and stopped taking it. Generally, it seems to be very well tolerated. And it's essentially a foodstuff, which is, we think, increasing the amount of a important component of a healthy diet for people using it. So I think it's quite unlikely that there will be anything wrong. But I'm just cautious about making a recommendation for millions of people based on, obviously what we think is incredibly encouraging initial results. But I think there's definitely one more big study that needs to be done before we can start really advocating for this.
Do you have any other dietary advice for patients with COPD? Anything that a COPD patient should eat or avoid, or any, targets that they should seek?
I think it's important to try to eat a healthy diet. And, I think one of the major issues around this is not so much what particular food recommendations we should be giving, but actually to sort of step back and think about COPD as a manifestation of structural violence. I mean, you can't eat a healthy diet if you can't afford healthy food. So I think for a lot of people, COPD that is much more common in poorer people and in more deprived populations and so on, that it is just one element in the things that people need to live a healthy life is food and warmth and shelter and so on. And just thinking about how much the sort of healthy food plate actually costs, it is cheaper to eat bad food. So yeah, I always feel a little bit awkward, giving food recommendations in this context. But I think, clearly the standard healthy diet, fruit and vegetables, not too much animal protein, I think is good advice for people with COPD as well.
Very good. Is there any other information that our audience should know about regarding your study or any future studies related to this field?
Well, obviously, we hope that we can, get the funding necessary to do the definitive study on this and, have it in guidelines soon. I think the other thing that is interesting in this area is that this effect of dietary nitrate on blood pressure, has been known about for a while, but it does seem to be in a bit of a blind spot for the cardiology community. It's a little bit surprising to me that we don't already know the answer to this, because the cardiologists have done a study in 50,000 people. I don't think it would need to be that large. So it does feel slightly strange to be pioneering this from the respiratory point of view. I think there's a particular issue around COPD, that the sort of multimodal effects of this mean that we're showing a benefit in terms of cardiovascular risk while lowering blood pressure, but it seems to be improving exercise capacity as well. And of course, people with COPD both have cardiovascular risk and difficulty walking around because of the sort of lung disease. And so it's a sort of interesting place to be approaching it from.
Very good. One reason is our COPD patients, as you've noted, have a lot of cardiovascular comorbidities. And so I think there is a dual benefit for our patients with COPD in taking nitrates and other supplementations. Thank you so much, Nick, for joining us today. And I thank the audience for joining us today. Professor Hopkinson's paper, Oral Nitrate Supplementation Improves Cardiovascular Risk Markers in COPD, a randomized controlled trial, is now available on the ERJ website, erj.ersjournals.com. Thank you.